All right. Hi, I'm Anthony. I'm the student pharmacist going to be helping you out today. How are you doing today?
I'm doing all right. How are you?
Not bad. Could I start by getting your name and date of birth?
Yeah, I'm Alex Tremor, and my date of birth is 5/25/1979.
Okay, perfect. And what brings you in today?
So I've always been a worrier, but lately I feel like it's starting to take over my life.
Okay. Is there anything that's been like bringing on this worrying, or is it just coming out of nowhere?
Um, you know, I presented to my clinic, this is what my doctor wrote, with complaints of a lot of anxiety, like worsening and persistent anxiety.
Mm-hmm.
I've been feeling on edge and experiencing these really racing thoughts.
Okay.
My anxiety symptoms have been progressively impacting my daily life and overall well-being.
All right. I'm really sorry to hear that that's been impacting your life like that. I think by the time you get out here today, we'll have a good plan for you that can help you get back on track and help you feel the way you've been feeling normally. First, is it all right if I just ask you a couple questions?
Yeah, of course.
Okay, so I just want to go over your past medical history for a little bit.
Mhm.
Here it says you have hypertension, sleep apnea, and you use a CPAP machine, type 2 diabetes, and then based on your body mass index, you would be in the obesity class 2. Is there any other medical conditions that you have?
No, just anxiety.
Okay. And then some medications on file that we have for you. We have that you're taking metformin, 1,000 milligrams twice a day, Jardiance, 25 milligrams daily, amlodipine, 10 milligrams daily, irbesartan with hydrochlorothiazide, 300 milligrams and 25 milligrams daily, and then rosuvastatin, 10 milligrams daily. Is that right?
Yep, I take those and I'm super adherent to them.
Okay, perfect. That's good to hear that you're adherent to your medications. Do you take anything over the counter?
I do. So I take ZQL at night to help me sleep about once a week when I can't shut off my mind.
Okay.
But most nights I don't really take anything. There's nothing over the counter besides that.
Okay.
And those nights that I'm not taking anything, when I have trouble sleeping, I'll turn the TV on to try and distract myself.
Okay.
It'll kind of help turn off my mind.
Okay.
I normally fall asleep to TV those nights after a couple hours, but I'll turn it off in the middle of the night.
Okay. So, first of all, due to the fact that you do have obstructive sleep apnea, we definitely wouldn't want to use something like ZQL to go to bed at night. It is a CNS depressant, and it can cause you to have even more trouble breathing. It can cause some respiratory depression. And another thing is sleep hygiene is very important when it comes to not being able to fall asleep. You want to create an environment that kind of induces sleep and not induces things that will wake you up, like watching television. So there are definitely some sleep hygiene consequence that we could go over with you and help kind of create that ideal sleep environment and help you get some sleep. And hopefully once we treat your anxiety today, that should help take away some of your sleeping problems that you have.
Perfect. That sounds great.
Okay. What allergies do you have?
Nothing that I'm aware of.
Okay. Is it right if I ask you a little bit about your social history?
Yeah, of course.
In an average week, how much would you say you drink?
Probably 2 to 3 drinks a night.
Okay. In an average week, how much would you say you smoke?
I don't smoke.
Okay, that's very good to hear. What does your diet look like?
That's a great question. I know that my A1C is good, even though I don't check my sugar.
Okay.
The only thing is that when I'm stressed, I'll overeat and I like to snack on junk food.
Okay. So there are definitely some resources that we could help you with for that. Unfortunately, that isn't necessarily a super healthy coping mechanism when it comes to dealing with your anxiety. It is natural. Most of us do it. But I definitely think we could refer you to a cognitive behavioral therapist and maybe hopefully find some different ways to, as an outlet for your anxiety. Is that something you'd be willing to do?
Yeah, definitely. I've tried some other things before, but maybe that was for my weight. I don't know. I tried meditation, I've tried yoga, even relaxation teas, and marijuana a few times, but that only made things worse.
Okay.
And I'm worried about taking medication for my anxiety because I don't want to gain any more weight. And I feel like I just can't continue this way.
Yeah, I definitely understand that. And a lot of the anti-anxiety medications do cause some weight gain. So once we get out of here, we can definitely try to find an option that won't cause any more weight gain. How much physical activity would you say you get in a week?
I'm a high school teacher, so I would say, besides walking around the building, not much.
Okay. It's good to hear that you're definitely getting in some exercise, but there are some improvements that we can make there. The goal that we usually shoot for is 30 minutes of exercise at least 5 days a week, and that can even just be like moderate walking around. Just it helps if you put a number on it.
Yeah.
Making sure I'm not missing anything here. Is there anything else that you think I should know?
With my anxiety, I have seen a counselor every other week, which has helped, but
Mhm.
I'm still having symptoms.
Okay, we could definitely probably increase the amount that you're seeing them. We could maybe make that a weekly thing if
Yeah.
that would be something that you'd be open to.
Definitely open to that.
Is there anything else that you've noticed maybe helps your anxiety or anything else that makes it worse?
All I know is that marijuana was horrible. And
Okay.
it definitely made it worse.
Yeah, that can tend to happen. I would definitely avoid that when you know you're feeling a little bit more anxious. All right, what questions do you have for me?
The only thing I have was the doctor said that my blood pressure has been pretty good recently, but it did take a lot of medication to control. But I finally did get that under control.
Yeah, it looks like your blood pressure is pretty much right on goal with where we want it to be, so that's great. That you're staying adherent to those medications and keeping your blood pressure where it should be.
Perfect.
Do you have any other questions for me?
No, that's all I have today.
Okay, well, I'm going to go work up a plan for you, and then if you do have any questions, you can always give us a call back here at the pharmacy.
Perfect, thank you.
All right, have a good one.
You too.